Well, summer seems like the time that we are always thinking about or talking about skin cancer, but do we even know what we're talking about? Well, we have brought in an expert. We've got Dr. Shoshana Kindred from Kindred Hair and Skin Center to set us straight. How are you?
I'm doing really well. Thank you.
I'm happy to have you here because I feel like during the summer, we all think we're doctors. we think we're the experts. We're like, just slather on a whole bunch of sunscreen and we'll be fine. But that may or may not be the truth. That's why we have you back always for these Derm Myth Mondays to clear it up. So I want to start out with the sun. Is the sun the only thing that can cause skin cancer?
The sun is a very important risk factor for skin cancer, but certainly not the only one. One is increasing age. Just as we get older, our immune systems aren't quite as on point and increases the risk of a skin cancer, which is, by the way, the number one form of cancer in this country. Secondly, weaken immune systems, so certain medications or diseases. A great example is patients who've received an organ transplantation are at really high risk of a skin cancer that increases over time. So we want them to have an annual skin check. And then finally, of no fault of our own, a family history. So if you have a lot of relatives with skin cancers, you're at an increased risk as well.
Okay. And using the sunscreen, going back to the sun, I'm wondering if the higher the SPF, the better. I'm one of those people where I will actually burn. It looks a little crazy. It's always on my nose and right here and then my legs. So I've gone the opposite extreme where I get the highest SPF, and I've been told that that may not help as much as just what a regular 30. So tell us what we should be doing.
That used to indeed be the case. The higher the SPF, or better, but technology has advanced. So SPF 30 has about 97% coverage, and SPF 50 about 99%. So yes, we want it to be at least 30 or higher, but it's quality over quantity. The other criteria are broad spectrum. That is, it needs to protect us from both UVA and UVB rays.
Okay.
Water resistant, we don't want it to wipe off easily. Antioxidants to neutralize those free radical chemicals that do get triggered by the little bit of sun that does come through. And then finally, iron oxides or an equivalent that protects us from blue light from all of that screen time we've been getting.
Yeah, definitely need that. A little bit too much screen time. The next question I have for you, I think I already know the answer, at least for myself, but people of color oftentimes think that we are immune to skin cancer. Not the case, right?
Not the case. So the numbers are flipped for those of us with darker skin tones. We are definitely less likely to get skin cancer. The part that is unfair is that if we do get skin cancer, we're more likely to die from skin cancer. And the reason is stems strictly from the myth that we can't get it, so it goes unrecognized. And by the time we as physicians and your dermatologists see you for the first time with the cancer, it's so far advanced, it's not as simple as us cutting it out in the office. So it's very important that especially patients of darker skin tones know to be aware that skin cancer is a possibility and to come in if you see any kind of funny looking mole or growth, especially on your hands and feet.
All right, get ahead of that. And yes, check your hands and feet, because I think a lot of times we're not looking at our feet. They're way down there. Who's looking at
They're way down there.
Exactly. They are. They're way down there. Another thing, I remember being in college and some of my girlfriends, they would always talk about they have to go get their base tan before they go out to the beach or on spring break. They wanted to prevent the sunburns, and so they might go to tanning beds to do that before they go on vacation. Is that a good idea to sort of prep your body that way or no?
Every dermatologist from here to Hawaii hates tanning beds.
Oh.
So tanning beds emit UV radiation similar to the sun, includes the cancer-causing wavelengths, but at a greater exposure rate. We actually see, when I see a 20-year-old come in with a basal cell cancer, I'm seeing a patient who had tanning bed use starting in their teens usually. Whereas our skin cancer patients in their 50s, 60s, 70s, You know, when they were in their teens, they were on a roof at high noon on an aluminum foil blanket with Crisco on their skin, but their cancers didn't show up till decades later. There's something a lot more detrimental about tanning beds. So if you want to frequent your favorite tanning salon, use a spray tan instead. And we're definitely not fans of a base tan to prevent a sunburn because you're trading in sun protection for an increased risk of skin cancer. So just protect your skin and leave well enough alone.
It is no wonder that you were just named, I have to brag about you, Physician of the Year by the Daily Record. We're so proud of you here at Midday
Thank
Maryland.
you.
Congratulations on that honor. And if people want to get in touch with you, I know you also have a book. How do they do that?
Yes, thank you. And also thank you to the Daily Record for that honor. So the book is Dermamyth, Breaking the Skincare Cycle of Myths, and it's available at dermamyth.com, but also our website at kindredhairandskin.com, as well as Amazon.
All right, Dr. Kindred, appreciate you being here. And we'll be right back with more Midday Maryland right after this. Stay tuned.